Good evening. Prisma is building that new behavioral health hospital in Pickens County. They say it will be state-of-the-art with services for children and adults.
Prisma Health leaders tell our Chloe Salsameda why they say this facility is so needed.
Over the last several years, state and local leaders say South Carolina and the rest of the country have experienced a behavioral health crisis, with more people needing support and hospitals running out of beds. A new hospital from Prisma Health aims to alleviate that.
The intersection of Highway 123 and 153 in Pickens County will be home to Prisma Health's new inpatient behavioral health hospital, providing psychiatric care to hundreds of children and adults each year. The three-story hospital will replace the Marshall I. Pickens Psychiatric Hospital at Greenville Memorial, which leaders say doesn't have enough space to treat all the patients in need of care.
In the upstate, we do have fewer beds than other parts of the state, so there are times where we have to send kids to Columbia or Charleston for inpatient care.
We're going to actually nearly double our current bed capacity from 65 beds to 112 beds. For child and adolescent care, we're going to actually quadruple our capacity from 10 beds to 40 beds.
The hospital will sit on 46 acres, surrounded by nature.
All of the rooms will have exterior windows that will look out to a natural setting, trees, gardens, grass, that we believe is going to be incredibly helpful in terms of helping them to deal with their issues and not feel like they're confined.
It will have courtyards, basketball courts, and a wellness center.
The goal is to have our younger children under the age of 12 in one unit and adolescents in another unit. Our adults will be divided up into 3 different units for anxiety, depression, and general types of conditions that come in.
According to Prisma, the need for psychiatric care has risen substantially in the last 6 years. They say Pickens, Oconee, and Greenville counties' combined inpatient psychiatric admission rates jumped by nearly 50%. Dr. Karen Lommel says this is a result of the upstate's population growing and people experiencing challenging events.
After COVID and a shared trauma, so going through a world pandemic and more recently a hurricane, we've really faced a lot of challenges in our community, and this has caused a lot of strain on our families.
Prisma is hopeful the new hospital will be an invaluable resource for the upstate community.
So I hope that patients leave the facility feeling restored, feeling connected to their families and their loved ones, and also know that if they do need help again in the future, that they will seek our help again, knowing it's a healing environment.
Prisma plans to begin construction in 2025 and open the hospital in 2027. In Greenville, Chloe Salsameda, 7 News.
The hospital is expected to cost $138 million to build. The state of South Carolina provided a $100 million grant for the project. Prisma says it will cover the remainder of the cost, and the project still has to be approved.